As part of the R3 training and the hands-on training, you'll also get to experience a procedure of your choice, either an infusion of stem cells or exosomes or a direct injection into the joint. When I went through that myself and had the privilege of getting a procedure on myself, it was a great learning moment for me, because I got to experience the procedure from the patient's point of view. And that allowed me to communicate with patients better when I sit with them, telling them that I am familiar with this procedure, both as a program director in a clinic and as a patient who received those procedures. You'll understand better how it feels to get a procedure like that. And to me, it just helped me tremendously to guide the doctors that we work with in our clinic to how to address patients' concern when they're communicating with them.